हेलो एवरीवन। आज हम लंबर वर्टिब्रा आइडेंटिफिकेशन करेंगे। सर्वाइकल थोरेसिक वर्टिब्रा के आइडेंटिफिकेशन के लिए आप मेरी प्रीवियस वीडियो देख सकते हैं। अब हम टिपिकल एंड एटिपिकल लंबर वर्टिब्रा के आइडेंटिफिकेशन फीचर्स देखेंगे। तो जैसे कि हम सभी जानते हैं, देयर आर 5 lumbar vertebra in human body. Out of these, first 4 are typical lumbar vertebra and fifth is atypical lumbar vertebra. Is identified by large body. It is large and massive body, absent of costal facet, absence of foramen transversarium. See, in thoracic vertebra, costal facet, and in cervical vertebra, foramen transversarium is present. Body of lumbar vertebra is kidney shaped and massive. Transverse diameter is more than the anterior posterior diameter. Height of the body is slightly greater than the anteriorly as compared to posteriorly. So it contributes the forward bending or forward convexity of lumbar spine. This is the anterior and this is the posterior. So it contributes to the forward convexity. It contributes for the जोड़कर देखें. So it's like this, forward convexity. Size of body increases from downwards. Means from L1 to L5, size of lumbar vertebra body is increases. Vertebral foramen, this is the vertebral foramen. We know all body, vertebral foramen and vertebral arch. These all are make the general features of vertebra. Vertebral foramen is triangular, which is greater than or larger than the thoracic vertebra. This is the thoracic vertebra. See, but smaller than the cervical vertebra. This is the cervical vertebra. So vertebral foramen, this is the vertebral foramen of lumbar and this is the vertebral foramen of thoracic vertebra. Pedicle is short. This is the pedicle. Pedicle is short but strong and it is attached more at upper half of the body as compared to lower half. See, body के upper half में connected ज़्यादा है as compared to lower half. So it clearly make deeper inferior intervertebral notch. Now come to lamina. These are the merge and forward forms the vertical plate or vertical quadrilateral shaped plate of spine. Now come to transverse process. Transverse process is directed laterally and slightly backward. Actually, here these are present the costal element. So real transverse process is present at the posterior side of transverse process. Here is the bony elevation which represent the transverse process. So this is the transverse process. This transverse process length is increases from L to this transverse process length is increases from the L1 to L3 vertebra and then it decreases. These are the superior articular process. You can find it. So superior articular process अधिक दूरी पर है as compared to inferior articular process and it superior articular process bears facet and these facet is concave directed medially and inferior articular process is convex and laterally. So these are the features of first to 4 lumbar vertebra. Now we see the last atypical lumbar vertebra, that is the L5. This is the L5 lumbar vertebra. In L5 lumbar vertebra, most important distinguished features short and pyramidal shaped, their base attached to the whole thickness of pedicle and is encroaching to the body. See, it attached to the whole thickness. पेडिकल की होल थिकनेस पर है एंड इट्स इंक्रोचिंग टू द बॉडी, बॉडी के तरफ जा रहा है और एक तरीके से बॉडी से ही डायरेक्ट इट्स मर्ज्ड. So spine is short, small and rounded. Height of the body and the anteriorly height of the body and the posteriorly height of the body is equal. So it forms the lumbosacral angle which is 120 degree. Superior articular facet and the inferior articular facet. These are the superior articular process and the inferior articular process distance are almost equal, or sometimes inferior articular process distance is more than the superior articular process. Thank you everyone. Like, share and follow for more anatomy videos.